Good morning, one and all. It gives me great pleasure and honor to welcome and introduce my very dear friend, Dr. Ramakrishnan, who we've been in touch with for over 20 years, I think, since the time he came back from the United States. Dr. Ramakrishnan is a healthcare entrepreneur who is American board certified in internal medicine, critical care medicine, sleep medicine, and recently obesity medicine. And he also has a master's degree in medical management from the University of Southern California. He is currently the Director of Critical Care Services at Apollo Hospitals, Chennai, and is a senior consultant in critical care and sleep medicine. He was the first board-certified sleep specialist to practice in India and established Nitra Institute of Sleep Sciences way back in 2004. After graduating from Stanley Medical College in Chennai, Dr. Ramakrishnan went on to do his internal medicine residency from the University of Connecticut and subsequently did his fellowships in transplant cardiology from Hartford Hospital, and then went on to do the fellowship in multidisciplinary critical care from the University of Pittsburgh. University of Pittsburgh is probably one of the largest critical care training programs in the world. Subsequently, he continued as a research fellow in the Department of Critical Medicine, same again in the University of Pittsburgh. And after being in the United Kingdom and the United States for over 13 years, he returned back to India in 2003 with a thought, in his own words, on making a difference by bringing innovative solutions in healthcare. And as I introduce you, you'll find that he's been true to his thought even today. He's been instrumental in developing the Chennai Critical Care Consultants Group. It is a first of its kind private practice group of critical care in India. In addition to the state-of-the-art clinical care for critically ill patients, the group also provides specialized remote monitoring through tele-intensive care units. And of note, the tele-intensive care unit monitoring center that they established in Chennai way back in 2010 was the first outside of the United States. The group has also successfully established the TACT Academy for Clinical Training, which is India's first simulation-based healthcare training center, and this center has won many awards, including for innovative concepts in healthcare education, and has also been listed for this distinction in the Limca Book of Records. Through the Saga Charitable Trust, Dr. Ramakrishnan has also been instrumental in developing social doctors by training non-medical persons for life-saving skills. He has been honored with a fellowship by the American College of Physicians, American College of Chest Physicians, American College of Critical Care Medicine, American Academy of Sleep Medicine, Indian College of Critical Care Medicine, and Indian Sleep Disorders Association. He also served as Vice Chancellor of Indian College of Critical Care Medicine and President of Indian Sleep Disorders Association. Dr. Ramakrishnan received the prestigious award of Best Doctor Award from the Indian Medical Association and the Tamil Nadu Dr. MGR Medical University, in addition to the Young Achievers Award from Vaishnav Group of Institutions. He's received the Presidential Citation Awards from the Indian Society of Critical Care Medicine for contributions in critical care medicine, and Vocational Excellence Award from Rotary Club and the Acharya Award for contributions to healthcare education. He is a respected teacher and an invited speaker in several national and international medical conferences. He has also authored 4 books in Tamil for the public addressing issues relating to ICU, sleep, and organ donation. He was also invited to meet the then Honorable President of India, Dr. APJ Abdul Kalam, who appreciated his contributions in the field of critical care and sleep medicine. Dr. Ramakrishnan is also a prolific researcher, having co-authored more than 100 scientific publications, both international and national, and published across very major, well-known critical care journals. Clearly, Dr. Ramakrishnan is someone who wears multiple hats with great aplomb, and there is no better person than Dr. Ramakrishnan to talk to you all and bring to you his experiences on how to go about your life subsequently. Thank you.
May I please request our chief guest for the day, Dr. N. Ramakrishnan, sir, to please address the gathering.
Good morning. It's a real pleasure, honor, privilege, and a lot more to be here with all of you on this very emotional day, if I may say so. Today, you're all students in a very protected environment, but tomorrow you're out in the real life or the world that's waiting for you, but at the same time comes with a lot of challenges. So any day I would rather be there than here. So, like we all think that it is better to be outside, but I think being in a college is always memories that you will have forever. My association with the Saveetha group of institutions is very, very long. In 1990, right after I finished my MBBS, I joined as a lecturer in Saveetha Dental College, where I used to teach pharmacology and pathology for the very first and second batches of Saveetha Dental College, the BDS students. I think it was kind of interesting when I heard Dr. Arun's introduction. And to you all today, it looks like I'm a successful doctor, successful entrepreneur. And honestly, that's the typical iceberg phenomenon. When you think about success, all that people see is the success, but there's a lot that goes underneath that. It's a lot of hard work, dedication, challenges, but more importantly, I think be ready for a lot of disappointments and failures as well. So when I was asked to deliver this talk to all of you, I clearly decided that I'm not going to preach, but I wanted to share some of what happened in my own life so that you understand that it's not always easy, and what you see here is something that's gone through a lot, someone who has gone through a lot in life. So I come from a typical middle-class family. In fact, in my school days, I think we used to live in a 300 square feet home. We're 5 brothers. I'm a youngest of the 5. My father was a professor. And when I did my school, I studied at Kolaperumal Chetty Vaishnav School in Arumbakam. And when I did my school education and finished, I was at that time the first one in Central Board of Secondary Education to get a 99% in biology. Okay. Now, I'm not saying this to brag about myself. I know today people get hundreds and 99 is probably considered not that good. But CBSE in 1983 was the first time they gave 99 in biology. And we got it, and I was the first, all India first in biology. And I was hoping that I would get into a good professional college. Believe it or not, I did not want to be a doctor. I wanted to be an engineer. So I applied for IIT, the usual stuff, and I got into BITS Pilani with a dual degree. And I think it was, I even forget it now, but I think it was electronics and also biological sciences. It was a combined dual degree that I got in. But my father clearly told me that he cannot afford to send me to BITS Pilani. So there goes that matter. So I said, okay, I think with 99 in biology, I should be able to get into medicine, hopefully. And those days, we didn't have NEET, we didn't have entrance exams, we had interviews. So we were the last batch of interviews for, this is 1983. So in 1983, I had to go for an interview and guess the kind of questions they ask you. I mean, even today, after almost 40 years, I'm able to remember that the question they asked me was, where was Gandhiji's wife born? I'm like, okay, now this is very relevant for me to become a doctor, right? So, but those were the questions that were asked. And for some reason, right after the interview, I was hoping to get into the medical colleges, and somebody filed a writ petition saying that the interviews were not conducted properly that year, so they wanted to go through the whole exercise all over again. So I had to take a call because I have now not taken engineering. I have to wait for my medical seat. I'm not sure if I'm going to get it or is it going to be delayed. So I didn't know what to do and spoke with my father, and I said, okay, I will join BSc Mathematics. Okay, so I joined Vaishnav College, BSc Mathematics. You might wonder why mathematics, because I was still hopeful I'm going to get into medical college and said, after these few months, no more mathematics in my life. So let me do BSc Mathematics so that I can enjoy that. So I joined BSc Mathematics 3 months later. So we had the interviews around April, but then we started our medical college only in October. So there was a long delay, and then we started medical college. And I was assigned Stanley Medical College, and I was very, very disappointed because I thought, I wanted to be in Madras Medical College. It's rated as the premium institution. Now I've got into Stanley despite, being a topper and all that stuff. But I'm saying all this for a reason, because I think everything in life, or I should say most things in life, happen serendipitously. There's a reason why this happens. So in Stanley, I could perform really well. And again, not to brag about myself, but I had 17 gold medals during my medical college. And after that, I was also the university topper in medicine, and the Indian Medical Association gave me the topper award for the best outgoing student from Tamil Nadu for all the entire medical colleges. But guess what? I received all these awards, and the next morning, I got the intimation that I did not get into post-graduation. Okay, so there you go. You finished your medical college. You think you've been successful. You think you've performed really well. But I did not get into post-graduation. That's when actually I said, I need to take a call on what I'm going to do with my life. Am I going to keep appearing for more exams here and try to get post-graduation, or should I go abroad? And I decided to go abroad, but again, due to financial reasons and stuff, I couldn't plan it immediately. I had to take some loans and make sure that I can afford to go to the UK. So I was working towards that for a year and a half, and during that year and a half, I used to work at Saveetha Medical College in the morning, and in the afternoon, I used to work with a cardiologist, Dr. Mishra. And in the night, I used to work in Vijaya Hospital in the nephrology department, all just to make sure that I can have enough funds when I go to the UK to start studying. So we did that. About a year and a half later, I went to the UK. And again, those days, you had to go there and take PLAB exams to get in for your training. So I did the PLAB exams, fortunately, successfully. And within about a month or so, I finished my PLAB exam and I was able to get a job. And then within 3 months, I was able to pass MRCP Part 1. So I thought, wow, this is great. Thinking back, I was glad I did not get into a post-graduation in India, because this is what life had in store for me. I thought, okay, now I'm able to go abroad. So what didn't happen was the best thing that happened in my life. So that if I had got into a post-graduation here, I probably would have never left the country. So I would have probably not had the experience. So I was doing my exams, and as I said, life always has a check on you at every stage. So I did my Part 1, and I wrote my Part 2, and I failed. Okay. I'm not hesitant to say this at all. I told you, I got 17 gold medals and you all applauded. But when I say that I failed, it happens. I think life does not always give you successes. So you need to accept that. At that moment, it's probably the worst thing that can happen to you. Was I disappointed? Absolutely disappointed at myself and with the world, saying, why is this happening to me? But then you have to move on. And again, as Dr. Deepak was saying, in the grand picture, after several years, all these are just memories and nothing else. But you can move on in life. So, and then I thought, okay, what should I do? And I went there with the aspiration of becoming a cardiologist. And I was doing cardiology, but I hated it. I said, this is not what I want to do. I don't want to be doing CATs. I don't want to be doing this. What I like in cardiology is actually the coronary care unit component or the critical care component. So I said, okay, I'm going to do critical care here. And in the UK at that time, you had to be an anesthesiologist to pursue critical care. So I said, no, I don't want to be an anesthesiologist. I want to do just medicine. So I said, okay, now I'm going to take my exams and go to the US so that I can do my training in critical care, because there you could do internal medicine and then do critical care. And the US goes through cycles, like there are years when they will open arms and take a lot of residents. There are years when they will not take anyone, because it's just based on the needs of the country, whether you will get in or not. So in 1993, I applied for some of the residencies, and in those days, it was good. It was relatively easier. I know this year has been very difficult if some of you had tried to match or whatever. So definitely it is not easy now, but those days it was a little relatively easier. And I decided to move on to the US and pursued my internal medicine residency again, because you can't straight go into critical care. So I did my internal medicine residency, and then I wanted to do critical care in the best of the institutions. And as Dr. Arun was saying, University of Pittsburgh is one of the largest institutions and a very highly reputed center for critical care. So I trained there. And at the end of it, and every time I used to come back to India, I used to keep telling people, I want to finish and then I want to come back here and make a difference. And invariably the response would be, this is what everybody says, but once you go abroad, you'll never come back. You're never going to be back, you are going to be there. I said, I don't need to prove to anyone, but let me decide on what I want to do with my life. So I did my training, and subsequently I said, okay, I want to go back. But again, we all have this, some kind of an internal ego or something that tells you that this is what you want in life and you want to achieve it. So I decided that, I want to go out of the US, but not because of visa issues that I can't stay here. I want to become a US citizen, but I want to go back and do whatever I want to do. Okay. So I decided that I would pursue research, and after my critical care, I pursued research and got a green card based on what is called an alien of extraordinary ability. So based on the research work, I could get a green card directly, and then subsequently became a US citizen. So, it was possible, but I said, no, this is what I want to do. And then I moved to a private practice in a smaller institution. And I was in private practice, and again, without elaborating on the details, suddenly there were some major changes in the private practice model. And the person who brought me and the person who was my boss or my supervisor was asked to leave. It was not even like he left on his own, he was asked to leave. And the institution asked me whether I would take over to head the critical care practice. So at that time, like right out of fellowship, just about a year, I didn't think I was ready to be, a leader to manage a group. So I decided that I'm going to pursue a management degree. So I went and did an MBA in healthcare management. It was not easy, because I already had a 2-year-old and the second one was on her way. So, so I have 2 children, family, but it was not easy. But I still think it was one of the best investments I've made going through a management degree, because as doctors, I think we are always taught to be individualistic. It is like my decision, I know to do it, this is how I do it. Whereas in management, you are asked to be a team player. So you work with a team, you promote the team, you are there as a leader, but you are not the one who's going to be doing all the action. So I really think it was one of the best decisions that I did. And after all this, I said, okay, now is the time and I want to go back. And in 2003, decided to come back to India with a decision that, and this by now I'm almost about 14 years out of the country. So came back in 2003 without a job. Okay, so I had not decided on what I was going to do. And I decided that, and of course, there were a few mentors who were guiding me on what to do. And one of the suggestions was to join Apollo hospitals, because at that time they were in a real need for a qualified critical care specialist due to a lot of reasons, some political, social reasons. They really were looking for qualified critical care person. So I went there, and I don't know where I had this courage. And like Arun was mentioning when he introduced me, that I wanted to come and make a difference. Like I I always believe in Steve Jobs' words where he said, when was the last time you did something for the first time? So you really need to do something different. So I spoke with the chairman of Apollo Hospitals and said, I'm willing to join, but I don't want to be a salaried employee of Apollo Hospital. I want to start a group practice. So the group practice concept was new, and we said we will start a group practice. And he said, so who is your group? So I said, right now it's just me, but I will form a group and I will get some people, probably locally, and start the group practice. And to give it to them, they were progressive enough to, accept that. And I was allowed to start a group practice. There were 2 intensive care doctors who were already there. And I went and spoke with them ahead of time. I was supposed to start on July 1st. And I went and spoke with them saying that I would like you both to be part of the group. We will start and this is how we will work. We will build the patients. We'll start a new model in critical care. So both of them nodded. And then on July 29th, one of them called and said, I'm leaving. Okay. So there was the group practice start where it was hard enough to find people. But one of them said, I'm not going to be part of the group. And the other one, I went and spoke with him up front and said, if you're going to continue for some time, we can start this. Otherwise, I cannot venture on this. But he was there to stay for a year. Without going into details, with that start, today we are a 30 critical care physician consultant group. So we have grown. We cover all of the Apollo hospitals in Chennai. We manage all the Apollo ICUs in Chennai. We also manage some other hospitals, Vijaya hospitals, another medical college, Balaji Medical College. So we manage several hospitals. And I also told Apollo hospitals that it's not just the group practice. I want to change the concept of this being just a corporate hospital and train more intensivists, train more people in critical care, and change the face of the ICUs here in our Apollo hospital. Again, we've come really far there, and today in India, Apollo Hospitals Chennai is the largest training center in critical care for the country. We take about 7 super specialty training candidates per year. We also started a training academy, which I told you, simulation-based training academy. And I started the sleep center or the sleep clinic in 2004. Again, with a lot of eyebrows being raised, saying that who will come to see you for a sleep problem? Nobody in India will come to a sleep specialist. It is true. You need the patients, because when I started the sleep clinic, I used to probably see 1 or 2 patients a week. Today, people complain to me that they're not able to get an appointment for a month. So, it takes time. It takes time to evolve. But I really think that having the vision, wanting to do something different, can certainly make a difference to everyone. And I really think that the group practice model has evolved so well. Again, even today, people think in India, group practice will not work. Not true. Not true at all. People should see the value of being in a group. There's so much that you can do together. And more importantly, you also get time for yourself so that you can have a personal life and have a good work-life balance. So all of those do make a difference. So I wanted to just say that nothing is easy. And as I said, there are so many things that didn't happen to me, but thinking back, it's probably the best thing that happened to me. So don't lose heart if you feel that there is some short-term losses. That's what I would call it. If you feel something is not happening immediately, keep working towards what you want to do, but also have the openness to accept certain other things that life gives you so that you can move forward. So I just wanted to, say a few things that I feel have helped in being a successful model of not only the group practice, but also doing new and new and innovative things. Number one is, right from today, although you are no longer officially a student, I think it's important for you to be reading regularly, keeping yourself updated, absolutely important, because this is one field, I'm sure it's true for several other fields, but this is one field where you cannot be outdated. The patients will not value you the moment you are doing something that is not current practice or current knowledge. And you need to be responsible, you need to be accountable. That's where I was saying, as a student, you have somebody to supervise, but today when you're out in the real world, you are the decision maker. Whatever decision you make is going to help somebody's health, is going to save somebody's life. So absolutely being accountable is important, but more importantly, while you're doing anything, just pay attention to details, and don't stop doing your best just because somebody is not giving you the credit for being what you're doing. Continue to work towards that. Communicate well, not only with your patients, but with everybody else, because communication is the key. And a lot of the times, like we as doctors do not always convey good news. We also convey bad news. And conveying the bad news appropriately, being empathetic but not being emotional. I think having what we call the detached attachment, particularly in specialties like critical care, oncology, I think is absolutely a key thing. Being humble, because doctors, people do not respect doctors whom they think are very conceited. So definitely being humble, whatever you are, wherever you are doing it, is absolutely important. I would also say that you need to be ambitious, very ambitious, but not greedy. That's where I think it's absolutely important. He was talking, Dr. Deepak was mentioning about providing humanitarian care. Money comes, definitely comes. It follows, but I think as long as you are seen as a respected doctor, as long as you are seen as somebody who's committed to your profession and doing your best, that would automatically follow. And if you are ethical, people respect you a lot more. And I think this is one profession where you cannot move away from the professional ethics. And that's something, irrespective of whatever pressure you may have, I think it's key to remain ethical. Be patient. If you are a respected doctor, then the fame and your growth, everything would follow. So absolutely something that you need to take the time. And when I mention time, I think it's also important to do appropriate time management. I think if there's one thing that I would be proud of myself, it is certainly time management, because when you are jiggling around so many things in life, it's important to prioritize, but it's also important to say no. Okay, so there are certain commitments that you may have to refuse at a particular stage of your life. I'm not saying right now, but at some stage, like accepting certain things, not accepting certain things, managing the time is absolutely important. And separating your personal and professional life. Like when I come back home, my cell phone is not with me. People do not reach me after hours. Again, this is after several years of practice. I don't expect you to do that tomorrow, but certainly, I'm not available when I don't have to be. I always give time for my family in the evenings. Even if I have work, I come home and sit and do the work, so that my children, when they grew up, right now they are both, graduated, mastered, and they're living abroad. But I think, being available for them when they needed me was absolutely important. Dr. Arun led several of the achievements, laurels that I have. In my office, I have several of them displayed. But I think the one thing that I'm very proud of that I have displayed in my office is a certificate given by both my children that I'm the best dad. So I really think that is something that I value a lot more. And I'm not joking. Anybody who can come to my clinic will see that up front, because I think that's a certificate that I value a lot. So maintain your professional work-life balance, absolutely important. There's a lot to life. Life is beautiful. I'm sure you will all enjoy it. Start today, and there's a lot in front of you to achieve. I do want to specifically thank the Saveetha group of institutions and all of you for inviting me here. And I think I must say that Saveetha has always been an institution, a group of institutions with a vision and always progressing at a very rapid rate. It's hard to believe that you're just the 10th group of, or 10th batch of MBBS students passing out. I think the reputation of Saveetha Medical College in this 10 years is a lot better than several institutions that have been around for several years. So I'm very confident that Dr. Deepak was saying that he wants several of you to go to the All India Institute of Medical Sciences. I think in a few years, there will be a speech in All India Institute of Medical Sciences saying they want their students to come here for your post-graduation. Congratulations and best wishes to all of you. Thank you.